Inside Science.
Personally, I've got drawn blood, and just the thought of going to the lab to get drawn blood is a fear experience. Then obviously, there's a real trauma of the needle stick itself. So trying to make it pleasant would definitely be a benefit. When you draw the blood, there is significant anxiety component to this than the physical component. HCAP scores is a score that is done for patients who are in the hospital. It's a survey that is administered to patients when they leave the hospital, and essentially it is to determine how satisfied they are with the hospital stay. And one of the questions in that survey was, how was your pain controlled and how was the blood draw? When a courteous blood phlebotomist did the blood draw, the pain scores were less, even though there might have been multiple sticks for drawing the same blood. So it was not directly linked to the number of needle sticks that he or she felt, but they were more correlating to the person actually doing the blood draw and in terms of how courteous they were to that individual patient. I think it's extremely important for healthcare providers to recognize that a sick patient is in a vulnerable state, and making them feel at ease and to sympathize with him or her and to be courteous to them makes a large difference on this individual patient. These systems can essentially change healthcare practices across the hospital and then could be implemented across the country.
Inside Science. If you enjoyed this edition, follow us on the web and social media. Powered by the American Institute of Physics and a coalition of underwriters.